One of the drawbacks of keyhole heart surgery is that it is actually a very complicated technique to learn, and it does involve a great deal of learning for the whole of the clinical teams in the operating theatre. So my perfusion team have to learn the discipline in a way that's different to the way they normally would deliver heart-lung bypass for a patient who's having heart surgery through the breastbone. The anaesthetist has to change many of his techniques. The scrub teams have to change what they do. And of course the surgeon particularly has to change and learn many new techniques that often involve doing surgery on a television screen in 2 dimensions as opposed to looking directly at the heart in close proximity. Of course, you can imagine when we do keyhole heart surgery, sometimes we're a long way away from where we're operating, and rather than looking at what we're operating on, we're often looking at a screen. These are really difficult disciplines to learn. Once they're learnt, however, I think surgeons really can deliver on some of the benefits. So I think it's very important for patients to ensure that the clinical teams that are offering them keyhole heart surgery have been able to do this for a significant period of time, and it's always good to know what volumes of keyhole heart surgery units do, how long they've been doing it, and what their outcomes are. That really will help you to select your keyhole team. The other drawback, of course, is that we can not always guarantee that the operation can be completed through the keyhole. So every patient who we see at the Keyhole Heart Clinic will always be warned about the small but real risk that we convert. Now, what does convert mean? What it really means is that if we start through a keyhole incision through the right side or through the left side for a bypass graft, for example, then during that procedure there may be something that means in order for us to complete that procedure perfectly or to keep things safe, we go back to the breastbone incision. So theoretically, there's always a small possibility you can end up with 2 cuts instead of 1. And I think that the majority of patients I see understand and respect that small risk in recognizing that that's how they would pursue the benefit that keyhole heart surgery would offer them.